can I say?
I know. Good morning, everybody. Welcome to Talking Tuesday. I'm just putting my phone on silent. I've had it on loud this morning because I was waiting for the doctors to ring, so I'll turn that off. So you've got my full attention. Today I'm joined by Tony from Hartlepool Healthwatch, and he's going to tell us all about what Healthwatch do, and how to get involved. Good morning, Tony.
Good morning. Morning, everybody.
How are you doing today?
Not so bad. As I say, I'm just getting the technicalities out of the way and ready for any questions. I feel like it's good. I think this technology is, especially for organisations like we have been a lifesaver while we've been in, obviously, while COVID's been on and everything else. So, yeah, let's get cracking.
Definitely, completely agree. So for those guys who don't know, what is Healthwatch?
So Healthwatch is basically a patient organisation. It was set up in 2013, and it was basically set up to give patients a voice regarding their own experiences of using health and social care. So for many years, there were occasions in health and social care by which things went really badly wrong. And a gentleman called Robert Stevens held a public inquiry on behalf of the government back in 2012, 2011. And from that, one of the recommendations was that the patient should have a voice. There should be a statutory body that gives patients a voice for them to make complaints, to ask questions, to also praise as well. I think we forget that a lot of people only open their mouth, so to speak, and stand up and say something when they get angry or they get agitated and they're unhappy with the services that they've received. So Health Watchers, we're very much about not just looking for the things that aren't working, but we love to praise good standards. And we always look for that. Because if one organisation is doing something well, why isn't another organisation in another locality doing it well? And the Healthwatch network is based over England. There are over 150 Healthwatch. So within the North East, you've got Healthwatch Hartlepool, you've got Healthwatch Sunderland, Healthwatch Newcastle, so on and so forth. For anybody that lives outside Hartlepool, if you want to find your own Healthwatch, you simply go to the Healthwatch England website. Now, Healthwatch England is the governing body, so to speak. It oversees the whole network, and there is under there. So you simply put your postcode in, and you can find your own local Healthwatch, which falls within your constituency, so to speak. So anybody can become a member of Healthwatch. What we like to do is encourage people to join our organisation, simply to receive information. The work that we do, all Healthwatch use volunteers. So a lot of our volunteers are predominantly of working age or retirement, but a lot of them are ex-nurses, social workers, administrators. So we've got a wealth of experience that can help us along that road. But you may be somebody who basically never had anything to do with health and social care, but it's something that interests you and you'd like to make a difference and you'd like to volunteer. So if you came to our organisation, there are little bits of training that we give you. We would give you like an introductory training into it. Within the Healthwatch England, there is a video that you can watch that tells people about, what being a volunteer is. If we did a specific piece of work, for example, if it was around dementia, now a lot of people might know what dementia is, but they don't know, dare I say, the inner workings of what somebody with dementia goes through. The condition itself, what family members go through, and what treatments are out there. So we might put that person on a dementia awareness course, and that will underpin any knowledge that they already have and help them and support them with any work that we do. For example, it might be just survey work. It's sometimes simply talking to patients and their families in a particular health setting. So it might be in a care home. It may be face-to-face in a person's home if they wish to do that. It's whatever makes that person happy, really. And as I said, that applies to any training and development is very much a part of Healthwatch as an organisation, and that's for its members already. As I say, even though we have a lot of people who've come from there with a health background, health and social care is forever changing, whether it be on a legislation point of view or whether it be on a treatment point of view as well. And so we do our best to have training and development, and our development officer, Stephen Thomas, takes care of that side of things. So another area that I think we need to mention is that when it does come to making a complaint, we have an organisation called ICA. If anybody can say that, that's it. And the Independent Complaints Advocacy has the contract for advocacy services within the North East that works specifically with any Healthwatch in the North East. So if you have a complaint, but you're not quite sure what to say, you really don't know who to send it to, and you're not quite sure what to do when you get a response, the advocacy service can help decide, you do that. They can formulate a letter on your behalf. When you get a response, it's what you want to do next. You may not be happy with the response that you get. And that can sometimes lead to the health service ombudsman. So the advocate can help you decide what you want to do as well.
I suppose as well, a lot of it will be sort of medical jargon and stuff that you might not necessarily understand. So can they sort of help put it in, I don't want to say layman's terms, but layman's terms so that you actually know what they're talking about?
Well, I think that's an obligation with regards to any response that you receive. It has to be in a language that any patient can understand. Because for far too long, I think that's where a lot of patients felt confused. They were receiving complaints that had so much jargon in them, whether it be about the condition or different organisations that were spoken about. And as I say, that is something that is an obligation now. So when any response you receive from, say, the local trust, for example, they have an obligation to send you something in a format that you will understand. So do you want to buy email? Do you want to buy a letter? Remember that you do have people who have sight and sound conditions. Sorry, I beg your pardon. Sensory conditions by which they may want an interpreter. They may need it in a format that works for them. And for far too long, we found that there are a lot of patients that, and it's still happening as well, unfortunately, that people with sight issues, deaf issues, or both, are basically not being given the right format. And for example, when they go for appointments, we're still hearing of patients being shouted out by a deaf person sat in the waiting room. Those kind of things, or there are no visual aids within the waiting room. So that's something that we've done a lot of work with in Hartlepool, with the local deaf centre, as well as the local trusts and GP surgeries to encourage them, because they are due under equality law to actually provide these ways of communication. So as I was saying, with regards to any complaints, there is a time frame. It's around about 20 days, 25 days, around about that time period by which a complaint will go through a particular process. Depending on the nature of the complaint, the severity of it, how many people are involved, and if there are multi-departments involved. So you might have an ambulance service, you might have A&E, you might have the hospital ward the person was on. If there was an individual at each stage of the complaint that needed to be spoken to, sometimes there is an extension on how long that complaint will be dealt with. But that's something you would be advised with, either from the advocate or by the hospital. And as I said, we have a really good relationship. In normal times, we are based at the Orc Health Centre in Houghton Manor, and we would normally have a drop-in service, and that would be a private and confidential conversation between the advocates and the patient, or a member of the patient's family. And that is completely separate from Healthwatch. We don't interfere in any way, shape or form. We are simply here to facilitate the opportunity for a person to make a complaint if they need advice. So currently, if anybody does make a complaint, and I could contact a person, it will be purely via the telephone or in a format, as I say, it might be via email if people are more comfortable. Some people don't like speaking on the phone and the like. So that's the advocacy service that we have. Excuse me, I'm just going to with that. So something else that Healthwatch do as well is the fact that obviously mental health is huge as a subject, and certainly within the times that we're living in, it's very much a subject matter that's been close to our hearts over the years. And we are very much involved in one of our members especially is involved in the local mental health forum. And this is basically once every, if I remember rightly, 3 months, I believe. It might be less, I'm not sure. But basically, service providers, service users, and other organisations, local authority, as well as ourselves, all meet together to discuss all things mental health. And organisations who want to promote themselves can come along to this particular event. Now, I'm not sure what the situation is presently, obviously, until we get to past, say, June 21st, by which lockdown ends. There will be more mental health forums going. And anybody can ring our office at Orc Health Centre in Houghton Manor and just simply ask the question. If they want to go along, they're more than welcome. either to observe or to actually meet the organisations in question, or if they want to promote their own mental health service. Okay. So, and we did create a directory. And this is the directory which I can send out to people if anybody wants one. That's our leaflets to show a lot of the services that you see in our directory. Some of them are well known, the national organisations like Mind or Samaritans, but you get, dare I say, niche organisations that are much smaller, can be smaller charities, maybe around baby bereavement, it may be around motor neuron disease, or it may be around simple organisations that are right on your doorstep. You may have walked past them many, many times. You do find some organisations are very small premises, small staff. They don't have a way to advertise, really. I think another area that people should think about looking at is the Hartlepool Now website. Now, I know
it's fantastic now. It's just been renewed, hasn't it?
That's right. I've noticed I was on there yesterday because we were managing off an organisation called Cooth.
Yeah, Cooth's very good.
Yeah, that work with young people regarding mental health. And they're based in London, but they do have a regional representative. And I basically advised that gentleman, Andrew, to have a look at the Hartlepool Now so he can promote his own organisation. The fact that you can look after you and host your own information, everything else, I think is one of the was a real step forward for people rather than relying on other people to look after your information, updating.
Yeah,
definitely. So that's pretty much the outline of what Healthwatch does. But the current work that we're doing at the moment, I made a short list. I'll just talk about it shortly. Obviously, we all use hospitals from time to time, and the local North Tees and Hartlepool Trust have to produce by law a set of quality accounts. And basically, this is a summary of their performance only over a particular 12-month period. And what they do is they send us the quality accounts for us to review. These also are sent to the Care Quality Commission, the national regulator for all things health and social care. So when we get the quality accounts, they do cover specific areas, and I'll quickly read. So they cover patient safety. So you're looking at mortality, dementia, mental health, safeguarding, and infections. There are so many aspects of hospitals that we until you think about them, there's so much to cover. So there's effectiveness of care as well. So you're looking from learning from deaths, discharge processes, accessibility, violent incidents. Now that with regards to how patients behave towards members of staff, I think a perfect example would be in A&E when you may have drunken patients who decide to take a swing at one of the doctors or nurses, those kind of occasions, as well as patient experience. So that covers palliative care. That's basically a person with a terminal illness who is then given the best possible treatment to make them comfortable as best they can. Is the care good? And this is very much about patient experience surveys. This is about patients giving feedback to the hospital about their experiences of using the service while they're there. And there is a national patient experience test that most patients are always asked when they go a friends and family test. And this is very much about asking a simple question about, would you recommend our services to another person? You know, if they were due to come to this hospital, would you say, yes, I would? And they gauge, a form of feedback and level of, how people like their particular services, good, bad, indifferent, or whatever. And that helps the hospital gain a level of understanding as to how patients have actually enjoyed using the services. So that's the quality accounts that I mentioned. Does anybody have any questions or anything before I go any further? I know this is quite a lot. Yeah.
I was just going to say that don't forget, if you have got any questions for Tony, please don't hesitate to put them in the comments, and he will do his best to answer them. If anyone's watching and wants to ask anything, please feel free.
Yeah. So one of the other things that we're doing, and it's a continuation of a national survey that was done last year, is basically the Because We All Care survey. And this was basically for not just ourselves in Hartlepool, but the whole of the network, the Healthwatch network, to basically get via a survey to get a picture of what patients are happy about. And this has also included COVID within the survey. So areas that people are looking at around GP services, hospitals, dentists, opticians, local social care services. So when you're talking about social care, you talk about care homes, for example. And it gives people an opportunity to give basically their own feedback, whether it be positive, negative, and also any ideas they might have. And what it does is it also helps us decide what we want to do on any particular work programme. Because the spectrum of health and social care is so large, we have a finite amount of time and a finite amount of people to complete particular pieces of work. So it may be kind of work that we do, maybe surveys, but speaking around patients and gathering the views and then formulating that information into a report that makes recommendations, highlights the good and the bad, takes a long time, believe it or not. It's a perfect example of that was a few years ago. We did a piece of work around hospital discharge. We included everybody within that report. So we invited them to a get together by which they give us all their ideas, all their own information, everything else. And then something that we thought would last 6 months lasted well over a year. And I think that the problem sometimes is that when you do take a piece of work on for it, have any meaning or to have any standard of information with regards to its quality as well as quantity, you really have to sometimes jump in the deep end. So I think to get things done sometimes from any Healthwatch perspective, sometimes you keep it small, but you keep it like valuable as well. You do pieces of work that you know you can fulfill and will make a difference to any particular services. With any Healthwatch, ultimately, its aim is to influence healthcare providers and commissioners to provide the best health and social care for patients and families. Okay,
which is I think something we can agree everybody wants.
Totally, yeah. And I mean, we do see it from time to time. Unfortunately, there was one on the other day about maternity deaths in a hospital by which over a period of time there'd been, I think there's nowhere to say other way, there'd been literally a cover-up with regards to mortality of infants within a particular hospital. And every now and then these really, really serious events happen. But I think what we find is it's very much just individual experiences with regards to things like, if you go to the hospital, there may be poor communication, it may be staff attitude, it may be a mix-up with regards to medication. I think hospital discharge, once again, is still an issue for some patients. And one area of that is that elderly patients, unfortunately, and even if it's one out of 100, it's too many, are being discharged at the wrong time of day. So when I say the wrong time of day, I actually mean night time. So we recently had a report of a very elderly person that had been sent home in a taxi at 11 o'clock at night. And this person had dementia as well. So those kind of occasions are just unacceptable. Bearing in mind that there are rules and regulations that hospitals have signed up to ensure that shouldn't be happening. But unfortunately, from time to time, it does. So that's one of the reasons we like to hear from patients regarding the response to their own experiences, so we can then challenge those services, whether we're a hospital or anywhere else, as to why that's happened. And I think above all else, what we are involved in is patient care groups that include the providers. It's very much about learning, because sometimes circumstances do come together by which a patient won't receive the best standards. And while it's not an excuse, it's amazing what circumstance can lead to, the wrong circumstances can lead to. But it's about ensuring that there are systems in place within services that ensure the patients get the best care possible. So that
Sorry, Tony.
Yeah.
I was just going to say, so if someone does have an issue with a health service, what's the first thing they should do?
Well, there are different ways, and I think what some people, I think GPs is an example. Some people think that, well, if I flag something up or I complain to a GP, it's going to affect my own
service,
my own service and my own care within a GP. This, on the surface, shouldn't be true. It shouldn't be happening. I'm not saying it is, but I think patients should always remember that you have, by the NHS Constitution, the right to complain. You have the right to ask questions. And I think sometimes if you feel that you can't speak to your doctor, the first port of call is simply to contact the practice manager within a GP. There is a report that's just come out, and I think that if people go to the Healthwatch England website or simply contact me, there is they've done a very, very in-depth survey over the last 6 months, and it was basically GP access during COVID-19, and they've produced a report, and it basically mirrors the very things that we are finding in Hartlepool, but on a national level as well. So it's things like inability to get through to appointments, inability to speak to the same GP all the time. Sometimes it could be things like, well, the doctor, I say, you're a woman who wants to see a female doctor to talk about, dare I say, female things. And vice versa, some people get embarrassed talking about specific things and they're like a person of the same sex to talk to.
Of course.
And I think also, once again, we're getting back to sensory loss, people with sensory loss who are simply not being catered for, not just in a GP environment, but also in hospitals. And this is something that we've been constantly telling commissioners and providers, that you have an obligation to provide appropriate interpreters, signage. As I say, to shout somebody's appointment name to a deaf person. And we had an occasion once where a person sat there for 4 or 5 hours until the GP shut, because the person there was nothing in that person's file, nothing within the system that showed that this person had a hearing issue. So those kind of things, it's just about changing attitudes and ensuring that people, as I say, GP surgeries, doctors, any particular service by which somebody with a disability or a sensory loss, especially if it's sight and hearing, which like doubles the difficulty for that person. So that report, as I say, is really, really good reading. It's very simple reading as well. Once again, it's in a language that people can understand, and it's there for the public to view. So if people visit the Healthwatch England website, simply on your browser, Healthwatch England, it's got all the latest stuff, or they can simply contact me at Healthwatch Hartlepool, 288 146, or if and you can have that in any format you wish, a paper copy, or you can have it simply emailed to yourself. It's in the public domain, so that the information is there for everybody to see. I think I'm nearly in now. Bear with me. So yeah, I think the only thing that I need to ask really is basically from carers' point of view, Sarah, or anybody watching today, if they've had any specific issues over the last 6 months or even 12 months by which they feel that services concerns, or if they want to make a complaint. Now, if they want to do this anonymously, they can simply email me or contact Healthwatch. And once again, if you want to make a formal complaint, we can advise you to use ICA. But I think what we want to do, and one of the reasons for today, is very much about people just giving a brief outline of the area of health and social care. Or if they want to go and do it a bit more in depth and do it privately, as I say, by contacting Healthwatch, letting us know, especially Hartlepool Carer Service users, the issues that they've encountered over the last 12 months, really.
I personally had an issue actually. It was lockdown related. I know it's one of those things that can't be helped. I had a fall literally just before lockdown,
Nice.
and I'd went to the urgent care and had done the X-ray and everything. They said, "Oh, there's no breaks. It's just ligament damage. Just rest it." Anyway, it got progressively worse. So I ended up speaking to my doctor, and they said, "Oh, you need to have a referral to MSK, but they're not taking referrals at the moment, obviously because of lockdown." So I was just sort of left, and then so I've now everything's sort of opened back up again. I've been back in touch with the doctors, and they're making that referral now. But obviously, that's sort of 8 months of being in pain and suffering, which I know can't be helped. It's one of those things, but it's frustrating. So
yeah, well, I think what we do find sometimes as well, the people that need not necessarily make a complaint, but want an explanation as to why the service is taking so long. You contact the patient experience team at North East or Hartlepool. It covers both sites. If it's a hospital that isn't North East, or for example, if it was South East, they will have within the hospital, they will have a department that deals specifically with people's queries about the treatment. And you can simply ask, some people use the patient liaison service, or as I say, the patient experience team and they should help speed things up. Because as I say, you are more than entitled to ask those questions. Sometimes I think, unfortunately, and this has been said on the national news many times, the reality of COVID means that things have really slowed down.
Yeah, of course.
And I think obviously for life-threatening conditions, this has raised a lot of concerns. And it was mentioned the other day that it could be a 5-year backlog, and it's just I think a cold hard reality of what COVID has done to the National Health Service. But at the same time, that doesn't mean that you can't ask those questions. You're perfectly entitled to, because you deserve an explanation, and you deserve to be kept in the loop, so to speak. So if it's something that you don't feel comfortable about, as I say, you could use ICA, the advocacy service, to ask those questions, because what a lot of people want from a complaint is an explanation of their own experience, why things happened in the way that they did, an apology, but also service change as well. The recurring line I hear from patients that contact us is, I don't want this to happen to somebody else. They're very caring and empathetic towards other people. And that's usually what leads to things changing. If organisations are sincere in when they say, well, we learn from this, our mistakes, so to speak, then those things should be changing when patients tell them that they want things to work in a particular way.
I remember it was my little girl's 10 now, and I remember when she was little, she'd gone to the doctors just for cold or something. It wasn't anything major, and they'd picked up she had a heart murmur. And we'd got the letter through to go and pick your appointment and things like that. So we picked an appointment. We'd gone through to, I think it was Darlington we'd had to go through to, and then we'd got there and they'd said that the consultant that she'd been organised to see wouldn't see her because she was too young. So it's that sort of thing, isn't it? That obviously when you're dealing with a little one and a heart murmur and things like that, and it's not a big thing in the great scale of things, and luckily in the end everything was fine, but you've gone all that way to see somebody about a concern that they've raised with you, to then be told, well, actually the person you've made an appointment with can't actually see you. So, but yeah, it's just little things, and obviously anything like that obviously somebody's had an issue with, you don't need to make a full-on complaint about it, but obviously if you raise it, then they know about it and they can hopefully improve it.
And as I say, I think communication and I think patient confidence and being able to ask questions, is so important. If as I say, your GP surgery is a perfect example. Don't be afraid of doctors. I think some people still have this complex as to doctors are up there and patients are down here, and we're not allowed to. They can tell us, but we can't ask them. And there's a name for it when patients go to see doctors and they have something they want to ask, but they don't ask it. And just as they're about to go out the door, the doctor says, "So is there anything else?" "No, doctor." And just as they're walking out the door, they say, "Oh, actually," because they've got that confidence.
Slip it in.
Yeah, and that's it. And that's what patients need to remember, is that you are entitled by law to ask the appropriate questions, or if you feel that you haven't been given a good service, just simply talk to the GP surgery. If you feel you still haven't got any further, then that's where you can contact Healthwatch, or you can contact your local clinical commissioning group, who should be able to answer the questions that you ask. And once again, as I say, it's communication is the issue. And it's a recurring theme, not just in GP surgeries, but right across the NHS from time to time. And when we do get a summary of complaints as well from ICA over a period of time, they'll give us a spreadsheet of complaints that have not just come from ourselves, but there'll be, for example, there might be a dozen complaints in 3 months that have all gone via ICA to the local hospital, NHS Trust of Hartlepool, and it'll be broken down. And once again, it'll be things around correspondence. People don't get the appropriate letters at the right time, and if they do, the appointments are at a ridiculous time of the day. It can be things like transport, patient transport. What people don't realise as well is that you can actually claim for transport costs as well. So if you need a taxi, if you use a taxi to get to a hospital and get back, there is a form that you can get within the hospital by which you can claim for that, especially if you're on benefits. So
Right.
these kind of things are there, but all of this, once again, and I'll keep talking about the internet, but on
Internet's brilliant, isn't it? It really
well,
is.
NHS Choices is an area by which you can basically type in a keyword and it will give you information on any particular subject, or you can visit the local websites for local hospitals. So Northeast and Hartlepool Foundation Trust have their own website, and you can find out anything about what that trust does on there. So if it was something about costs, if it was, even if you're not sure how to navigate the website, you can simply call the hospital, speak to the patient experience team once again, and then they'll be able to give you the appropriate information. So there is a lot of things that patients sometimes aren't always aware of for different reasons. I was just simply afraid to ask. And I think that there just needs to be, as I say, patience. I think rejection as well is sometimes if a person has a bad experience using health and social care, and they have a bad experience, that stays with people a long time. I know for a lot of people who have contacted me over the years, they'll want to make a complaint about something that happened 6 months ago. And one of the reasons that it's taken so long, especially it could be around bereavement, for example, is that it's as soon as you start to talk about something that really is emotive to you, you can become really emotional and upset, and you find that you can't actually talk about it anymore. Yeah. So it's very much about when the patient's ready to talk about that. Once again, that's why the advocacy services are so really good. It's helping that person because that person's on your side, and they're not judgmental. And once again, it's when the patient themselves is ready to talk about.
Is there a time period that you have? Is there a time period you have to get a complaint in? Just talking about obviously when you feel comfortable.
Yeah, I think
obviously the sooner the better makes it easier to investigate. But is there sort of a time frame you have to get it in by?
It's around about 12 months. If you can contact ICA about a complaint that's happened within 12 months normally, but they can advise you accordingly on how not so much whether you'll be successful or not. It's not for them to say so, but there is criteria by which complaints have to be dealt with, really, small print, so to speak. But if it's something from a long time ago, I mean, once again, it's all about the individual. It's all about the patient, and sometimes these things can be very, very serious. And sometimes, when you see serious issues that are brought up and you see them in the national press, it can be stuff that has happened from years ago. People, once again, just didn't want to talk about it for their own reasons. But yeah, I mean, there is support now, and as long as people know that the support, be positive, because that's sometimes for a lot of people, that's the only way they move on. The only way resolution is the only way of taking the next step, and they don't wake up in the morning and think that's the first thing to think about, or they just feel happier and their own well-being is improved as well by dealing with something that they have an issue with. And I think an example of that as well is within the mental health fraternity now, talking therapies promoted much more rather than giving people tablets and medication. People find that if they talk to an advocate or a counsellor about their own experiences, that this can help them with their own mental health. You don't want to talk to your local family because your family sometimes just tell you to get a grip, or you don't know what you're talking about, or they want something to be private as well. So that's why, as I say, another area of mental health, if you've got a problem and you want to talk about it, in mental health, if take the first step, speak to somebody about it, because there is so much support out there at the moment.
Yeah, definitely. Oh, thank you so much, Tony. It's been really useful. Yeah. Funnily enough, I'm actually off to the doctor's now to take a little one. So,
Can I just finally say, Sarah, if you want to have a think from your organisation, whether it be any of your service users or any people that you may know, if they want to complete one of our questionnaires or simply get in touch with us with any concerns, they can do this anonymously as well. Or any person watching today who wants to contact Healthwatch for any advice, whether they may just want to find a service that they're not quite sure about, we can give you an informed choice for you to make that choice. But we'd also like to hear of the very issues that have taken place over the last 6 to 12 months, whether it be COVID related or any other health and social care service, within Hartlepool. That'd be fantastic. Okay, so I really appreciate your time, dear Sarah, and anybody watching. Thanks for listening.
Thank you, Tony. Speak to you
Thank
soon.
you.
Take care.
Yeah. Bye bye now. Bye.
Bye. Bye, everybody.